This is a Fox News alert. Massachusetts now making history today, becoming the first state where universal health care is now the law. It's Governor Mitt Romney signing the bill. Just hours ago, he's also a likely GOP candidate for president in 2008. So is this something he'd bring to the whole nation? Governor Romney joins us now from Boston. Governor, the money shot for me is Ted Kennedy behind you. What do you think of that?
Well, it was a bit of a shock, as one of my sons said. Ted Kennedy supporting a bill which I authored. That's going to actually be a cure to global warming because hell is frozen over.
I do want to get into the particulars, Governor. I know you don't like to talk about presidential ambitions and all of that, but many in your party do. You've been written up even in the latest Newsweek as presidential timber given serious consideration. Would this be an issue that could go national?
Well, I think health care and education are two issues that the Democratic Party has held on to for a long time, but they haven't had answers. In education, they're so tied to the teachers union, they haven't been able to reform education. And with regards to health care, they keep looking at a universal coverage, which means single payer and government takeover, and people don't want that either. So this is really taking what the Democrats have talked about, a Democratic goal that we share, which is getting everybody insured, and solving the issue in a Republican way, which is applying a personal responsibility principle, reforming the market, and allowing people to buy private health care insurance, private insurance that they can take with them from job to job that's entirely portable. So it's a Republican way of solving a problem which we face as a nation.
You know, still the Wall Street Journal, a fairly conservative publication, you had a column in the same newspaper yesterday, but today in an editorial saying, by making a fetish of universal coverage, Governor Romney has brought into a bidding war with Democrats, and advocates of socialized medicine are bound to win in the end. What do you think of that?
Well, I think they're wrong in that, but time will tell, of course. Here's something I don't think that a lot of people recognize. We have a lot of people uninsured in this country, and yet all of them get health care. I don't think we recognize that. The cost of health care is very high, in part because so many people don't have insurance and expect everyone else to pay their way for them, either through taxes or through higher insurance premiums of their own. And so what I'm saying is no more free ride. Everybody comes into the system and they purchase insurance if they can afford it. If they can't, we'll give them help purchasing that insurance with the money we've been spending to give them free care. We're a lot better off as a society having people taking responsibility for their lifestyle, for their health insurance, and paying as much as they can afford so they have that coverage.
You know what worries me, Governor, when you set up things like a new board to help determine the acceptable insurance policies and all of that, I know that this kind of stuff always starts with good intentions, but you're a savvy businessman as well. You know it starts that way. And then I can see a board that might be beholden to politicians and bureaucracies, and then it runs amok. Even the president has seen that with his Medicare prescription drug plan. Started out as $300 billion. Last time I looked, Governor, it's $600 billion and rising.
Yeah, there's no question that, that if you have a legislature or elected officials that have as their intent raising people's taxes, it can go in a bad direction. And I think you have to say that we're going to fight very hard to make sure that doesn't happen. But you have to apply market principles to an issue as large as health care. And that's what's been done here. The Heritage Foundation worked long and hard to work with us to put together a program that allows small businesses to finally purchase insurance, health insurance, at the same kind of low cost that big businesses pay. At the same time, we had to find a way to get every individual the insurance policy they need at a rate that they can afford. Now, the board you're talking about is a board which enables people to be able to get insurance, take it with them wherever they go from job to job. And we're trying to get rid of the mandates in our insurance. Right now, if you get a health insurance policy in Massachusetts, it has to include in vitro fertilization. That doesn't make a lot of sense. We want people to have policies that are across the spectrum in terms of the benefits that are provided, and that's something which these reforms allow.
Let me step back from this, Governor, if you don't mind. When people are polled on this issue of universal health care coverage, a Fox poll that we did, 2 out of 3 folks say don't want it, don't see the need for it. What do you say about that?
Well, what they don't recognize is they've already got it. And that's the big surprise. Everybody in this country does get free health care. If they get sick, if people get cancer, or they break an arm or a leg, or they have, heaven forbid, a heart attack, they go to the hospital and they get treated. And then everybody else pays the cost of those individuals if they don't have health insurance or if they can't afford it themselves. So we have universal health care. What I'm saying is, for people who can afford to buy insurance, It's time for them to step up to the plate and buy that insurance. And for those who can't afford the insurance, we'll help you pay only what you can afford to pay. We'll help you get that policy, but no more free ride, because we have universal health care. It's time to get coverage, health insurance coverage, and insist that people pay what they can afford to pay. It's time for a personal responsibility to step forward rather than a government pay for people who don't have insurance.
Do you think, and I know you always eschew these political questions, Governor, so forgive me if I'm indulging that, among the conservative base, very powerful in your party, when it's seen that you're there and Ted Kennedy's behind you, that Hillary Clinton kind of likes your plan, and that conservative publications like the Wall Street Journal, while personally commending you, bash this plan, does that hurt a prospective candidacy?
You know, when I set out to find a way to get everybody health insurance, I couldn't have cared less, and I don't care less about how it works politically. In my view, it's the right thing to do. It's a key issue that faces many, many people across this country that don't have health insurance. We need to find a way to get them insurance so they get better care, and they cost us less money. Our analysis shows that having people insured means that they'll get preventative care and primary care, and they won't be showing up at the emergency room, which is far more expensive to government and to the rest of us. So this is an approach that makes sense. You know, I think with time that those who take a look at it are going to say this really is a good solution, and it's not the Democratic way. I recognize that some of my Democratic friends said, you know what, this is a pretty good idea, but this does not have an employer mandate. This does not have a government takeover. There's no government control of this system. Instead, individual companies can offer products in Massachusetts which they couldn't offer yesterday. Now they're going to be able to offer new products. People can buy them, take them with them. It's a Republican way of reforming the market. Because let me tell you, having 30 million people in this country without health insurance and having those people show up when they get sick and expect someone else to pay, that's a Democratic approach. That's the wrong way. The Republican approach is to say, you know what? Everybody should have insurance. They should pay what they can afford to pay. If they need help, we'll be there to help them, but no more free ride.
Governor Mitt Romney, thank you very much.
Thanks, Neil. Good to be with you.